As a physician, I've seen a lot of patients who have suffered from chronic disease complications. I've seen some of these problems in Egypt, where I used to practice, and also at Tufts, where I did my internship. And I'm really excited about this project because it's an opportunity for us to take some of the tools we've been building and apply it to a clinical setting. TrackMe was inspired by my partner's wife, Alice, and here's their story.
So every day I get up and check my blood glucose level, and I record it in a logbook. And I have to do this 2 to 3 times a day. I'm constantly thinking about making healthier food choices. I would have to say that diabetes does affect my quality of life. And even having to do all this, I'm still not sure if these things are improving my overall health.
Alice and I, we've been married for 35 years. And even though she's been a nurse for her entire career, we were so surprised to find out that she has type 2 diabetes. I travel often, and I'm worried about her condition when I'm away. So that inspired me to start TrackMe.
We see approximately 8,000 patients a month across our 5 locations. About half of our patients have one or more chronic conditions. We always struggle to stay in touch with them. That engagement we find is really challenging. I think the ability to get sort of real-time feedback from patients as far as their blood glucose levels could really be useful for us.
I think most people can understand a linear graph, and up is good, down is bad, or vice versa. So I think it could be helpful in a patient understanding whether or not their disease is getting worse or better. We had somebody to get us that information and take time away from us having to ask those questions to almost every patient that we see in here. How many times a week do you drink alcohol? How many drinks per those days that you drink alcohol? That would save us so much time and allow us that time to educate them about certain diseases.
Using positive trends as a motivating tool, to be able to say to patients, hey, great job. And for patients who are struggling a little bit, to be able to kind of use those numbers to work with them to figure out, gosh, what is it that maybe we could be doing better?
We've increased patient engagement by using a combination of a simple texting interface and a sophisticated HIPAA-compliant backend. Our goal now is to scale this to thousands of clinic and millions of users by building an API that can integrate with any EMR.
I believe with our strategy, we could improve the standard of care for millions of patients with chronic diseases across the nation.
We're really excited about this pilot project, and thanks for watching.